Dr. Chol came here from sunny San Diego, California. It does not get more challenging than this. This is a 71-year-old from Arizona who loves to play golf, but has a severe spine problem. He's got degenerative scoliosis, so crooked spine due to degeneration, not idiopathic scoliosis, and stenosis. He had a decompression from L3 to S1 by a very good surgeon, but unfortunately it's not enough surgery, and he still has left-sided radicular symptoms, and you can see why. This is the left side, and the spine is tilted that way at these three levels, and that pinches off the little side vents called the neuroforamina. And you can see it on the CT scan. This is the coronal slice view, so slicing from the front, like your face. You can see how it's so crooked right here. The spine should be much straighter, like up here, but right here, the left side is collapsed down. And that pinches off the little side vents right here on the axial view, called the neuroforamen. And look at how much, this is the neuroforamen right here. Look at these bone spurs that are pinching. The more clinically important image is this one right here. This is the Sagittal CT images. It goes through the side vents called the neuroforamina. That's the neuroforamina right there. So let me show you what a normal one might look like. Way up here, that's the neuroforamen. See how it makes a little circle? Two half circles make a circle. This one is pretty good. It's not great. But look at these three when he had surgery. Look at all this calcification. There's barely any space there. Look at that. Right there. That's the L3 neuroforamen. Here's the L4 neuroforamen right here. Right there. Look at that little hook right there. And look at this prominent area of calcified bone. And the nerve root is right here. Look at this little pointy bone spur pinching into the neuroforamen. And then at L5S1, same thing. Look at that. There's the hook, the tip of the supraarticular process, the bone spur from the end plates, that's called the disc osteophyte complex. And the nerve is in this little space right here. So you can imagine as he twists and turns and bends, that nerve gets pinched as the spine moves. So what he has been told by many surgeons is that he needs a fusion, which is probably right. The fusion will allow you to jack open these disc spaces and make them tall again, straighten out the spine, and realign the neuroforamina. But I can tell you, no one likes the idea of having a multi-level fusion with screws and rods and cages in your back, if you can help it. So he came here to see if I can just do a very careful, meticulous foraminotomy to make more room for all the nerves without destabilizing the spine so much that it will continue to collapse toward the left side and thereby avoid a fusion. And the best way to do that is with the endoscope, where you make a little poke hole and do all this through tiny little incisions, sort of like the way we do knee arthroscopy, shoulder arthroscopy, and cholecystectomy laparoscopically. Same idea, now applied to the spine. So this is going to be a difficult one because the exiting nerve root is right there, and it is really easily irritated by even just looking at it wrong. So I have to be extra careful, ×3. So wish me luck. That is a bad disc, Shansei. There's like no disc in there. Shansei. I'm going to be able to see it, no problem. What a mess it is in here. There's the bone, one of the bone spurs. This is L3-4, the highest level. The worst level. I like starting with the worst level. That's the inferior corner of that vertebral body right there. All that must go. Your nerve is so irritated. Look at all that redness. And it's stuck down too. We'll release that in a moment. Oh, look at how awesome the laser is. So precise. So complementary to all my other instruments. Yep, look at that. I'm right at the supraarticular process. I've already removed all this bone right here. I got to remove a little bit more right there. Down to here. And that's the tip right there. I can see it. Yep. And the nerve root is right there. Uh-huh. There's the tip. No more pinching. I got this bone spur off. Oh, yes. There's the nerve root. There's something right there. I got to get a little bit more of that. And that's always all the way down to the disc space. Yep. And I already got that corner of the bone right there. Laterally, Look at how far out I am. There's a big bump right here. Last remaining tip. Okay, L3-4 is done, for real this time. That's the inferior corner, laterally. Now I'm going medial. There's a disc space right there. That's the entry point to the canal. That's where Wagner's arch is. All that bone is now completely free. Lots of bleeding due to inflammation. Yep, look at that, totally open. All the way down to the undersurface of this bone spur, all the way to the pedicle. The exiting nerve root is buried inside here, and all this tissue totally protected from the forces of evil, as they say. And you can tell on the CT scan, left upper hand image. The nerve is all inside here, right there, and here. Shut and save, shut and save, shut and save. Okay, I'm at 4-5 now. There's Wagner's arch right there. There's the pedicle. There's the disc space right here. The exiting nerve root is to my left, protected with this cannula, but the cannula can compress the exiting nerve root up against the pedicle, so you have to be very careful. I use a combination of direct visualization or endoscopic direct visualization and imaging to make sure that there's plenty of room for the nerve. If you look at a lateral fluoro x-ray where the cannula is, there has to be room for the exiting nerve root proximal to me. That's the disc, that's the bone, and that's all the bone that needs to go away, part of, all the way up. That's not supposed to even be there. Everything is way deep to that. I got some works to do. There's the exiting nerve root right there. There's the facet joint capsule of the tip of the subarticular process. A disc? Oh yes, there is. Looks like epidurals too. Punk teenage kids though. Right on the bone spur right there. Look at the left upper hand image of the CT scan. That's the bone spur. Yep, and there's the edge of it. It goes up high. Oh, look at that. There's the nerve root there. This is that massive bone spur of L4. There's an over right there, look away. Okay, no more bone spur. To shear off the remnants of the bone spur once I make it thin. It's an advanced technique, don't tell anybody. There's the nerve root. Ah! Oh, I'm feeling good. There's where the bone spur used to be. This right here, this bone right there. The exiting nerve root right there, inside the perineurium. Got an unimpeded corridor all the way up. So I'm all the way up to the pedicle above. The nerve root's underneath. Look at that, medial laterally, I can get all the way to the canal. Oh, I'm liking this. Okay, look how far lateral I am. That's the left lower hand CT image. You get it all the way to the neuroforamen and the lateral margin of the canal. Oh, I'm feeling good. Right at that posterior corner, I'm going to take that down, move my more medial. There's a bunch more bone to the left of me too, but I'm going to get that last. Aha! I'm making my way there. This is the bone spur in the back of the disc space. There's the edge, the entry to the disc space. Oh yes. Okay, that's the neuroforamen, exiting nerve root, surfing along the back of the vertebral body. Let's see what that is. I'm at the top of the pedicle, right there. Yep, I got everything. Okay, so here's the disc space. That's the inferior pedicle area. There was a big bone spur right here. It's gone. There's a big bone spur right here. It's gone. There's the neuroforamen right here, all the way up to there. And the nerve is right underneath. Oh, yes. All done. Ooh-wee! Surgery's all done. 3 band-aids, 1 for the computer navigation tracking pin. And then I was able to do 3-4 through that incision, 4-5 through that incision, and 5-1 through the same second incision. So just 2. And it was a lot of work, I have to admit. I think I got a blister working so hard, but it went absolutely beautifully. We did very careful neuromonitoring, along with delicate Asian fingers and meticulous technique. And I'm really expecting a great result and praying for a speedy recovery. So best wishes.